Okay, I'm going to perform the first room scan. My supplies. Hi, my name is Rachel Burt, and I am a BSN to DNP student at the University of South Alabama, and I will be recording a cardiovascular and peripheral vascular assessment for my course NU518 Advanced Nursing Assessment. Mr. Thomas Burt, do I have your consent to film you for the purposes of grading and the viewing of my professors?
Yes.
Okay. Can you lie down in bed for me? So to begin the assessment, I would just have the patient lie down in the bed supine with the head of the bed 30 degrees and have the patient remove his shirt. Okay, so to begin the assessment, I'm just going to have the patient get in the supine correct position. I'm going to inspect the patient's chest. I'm going to locate the point of maximal impulse, which is at the 5th intercostal space, medial to the mid-clavicular line. And I'm just looking for any movements or pulsations, which I do not note in this patient. So I'm going to take my pen light at a 45-degree angle and assess. Okay, I do not note any pulsations or movement in this patient's point of maximal impulse. This may be difficult to assess in patients who are obese or heavier. Now I'm going to inspect the patient's jugular veins for any jugular vein distension. To locate the jugular vein, I am going to locate the patient's jaw and then go right above the patient's clavicle. So this would be the area that I would be looking for. This is the patient's right jugular vein. This is the patient's left jugular vein. And so in this patient, I did not note any bulging neck veins or jugular venous distension. If I did, that may be indicative that the patient has heart failure. Okay, so moving on, I'm going to move on to palpation. I am going to start by palpating for any heaves or lifts. Palpating for heaves or lifts is useful to identify any left or right ventricular enlargement. What I would be looking for is rhythmic movement or lifting of the pads of my fingers. And so to assess this, I would take my hand and place it flat on the patient's skin in the 4 areas that I'm going to assess. And so I'm going to start with the aortic area at the right of the sternum at the 2nd intercostal space. Now I'm going to move on to the pulmonic area at the left of the sternal border in the 2nd intercostal space. Now the tricuspid area in the fourth intercostal space to the left of the sternal border. And lastly, the mitral area, which is medial to the midclavicular line at the fifth intercostal space. Okay, I did not note any heaves or thrills upon palpation. And so now I'm going to palpate for any thrills. Thrills are vibratory or buzzing sensation that may be indicative of a heart murmur. A murmur causes like turbulent blood flow, so that is what I would be looking for. And to assess for thrills, I would take the ball of my palm and press it in the 4 areas that I mentioned before. So to begin, I will start with the aortic area at the second intercostal space to the right. Pulmonic area, second intercostal space to the left of the sternum. Tricuspid area, fourth intercostal space to the left. Mitral area or point of maximal impulse, mid clavicular line, medial, fifth intercostal space. Okay, during that portion of the assessment, I did not note any thrills. And so now I'm going to move on to the palpation of the carotids. But first, I'm going to auscultate the carotids. It's important to auscultate the carotids first because the patient, if they have atherosclerotic plaques, you may dislodge them by palpating first. So you would want to start with auscultating the carotids with the diaphragm of your stethoscope. I'm going to start with the patient's right carotid. Oh, and to locate the carotids, you would locate the patient's jaw and then go above the upper thyroid cartilage. Left carotid. I did not note any bruit, so now I'm going to palpate the patient's carotids, and you just want to make sure that you don't palpate the carotids at the same time because it can limit blood flow to the patient's brain and cause syncope. So I'm going to start with the right carotid, and I'm going to use my index finger and the middle finger, just the pads, and just press right here, right carotid. Left carotid. Okay. And so upon palpation, I did not note any thrills or bruits. All right, so the next portion I'm going to do is I'm going to auscultate the patient's heart sounds. Heart sounds indicate the closure of valves, and the S1 is indicative of the closure of the mitral and tricuspid valves. S2 is indicative of the aortic and pulmonic valves closing. And S1 is louder at the apex, and S2 is louder at the base. I'm going to listen with the diaphragm and the bell of my stethoscope. The diaphragm is useful for listening for more high-pitched sounds of S1, S2, and the diaphragm is more useful for listening for any low-pitched sounds of S3 or S4. I'm going to start in the patient's aortic area, a second intercostal space, right of the sternal border, pulmonic area, second intercostal space, left. The aortic is the right second intercostal space. Pulmonic is the left second intercostal space, left of the sternum. Okay. Erb's point, third intercostal space, left of the sternum. Tricuspid, right intercostal space, left of the sternum. Mitral area, fifth intercostal space, medial to the midclavicular line. Okay. Now I'm going to listen to the 5 areas with the bell of my stethoscope. Aortic area, pulmonic, Erb's point, tricuspid, mitral. During auscultation, I did note S1, S2. I did not note any sounds of S3, S4, or any murmurs. Now I'm going to listen for the patient's apical pulse, and I'm going to listen for 15 seconds while I count the beats. And I'm going to do this with the diaphragm of my stethoscope. And so to auscultate the apical pulse, I'm going to go to the point of maximal impulse, fifth intercostal space to the left of the sternal border at the medial of the midclavicular line. During auscultation, I did count 22 beats. And so what you would do is you would multiply that number that you got by 4. And so that would make the patient's heart rate 88. A typical or expected heart rate of an adult patient would be 60 to 100. So now that I have completed the auscultation portion of the assessment, I'm going to move on to the peripheral vascular portion of the assessment. So to begin, I'm going to start by palpating the patient's arterial pulses. To accurately assess for the pulses, you do have to use a grading scale. The grading scale starts with 3 plus or bounding. Then there is 2 plus brisk or normal, expected. 1 plus weak or thready, and 0 plus or 0 absent. And so to begin, I would locate the patient's radial artery. And to do that, I would go to the patient's the flexor area under the patient's wrist. And I would just take the pads of my index and middle finger and palpate the patient's radial artery. Okay, the patient's right radial artery is 2 plus. Patient's left radial artery is 2 plus, so 2 plus bilaterally. Next, I'm going to palpate the patient's brachial artery. To palpate that, I would slightly lift the patient's elbow and locate the patient's antecubital fossa. And from there, I would just palpate the patient's brachial artery. Right. Two plus in the patient's right arm. Two plus in the patient's left arm. Now I would palpate the patient's femoral arteries. And to locate the femoral arteries, I would locate the patient's ACEs and go in between the ACEs and the inguinal ligament. So I'm just gonna pull your short just a little bit. Two plus. Two plus. Bilaterally, 2 plus. So now I'm going to assess the popliteal artery. And so what I would do is I would have the patient slightly bend his leg, and then I would take my hands and wrap it around the patient's knee until my fingertips are at the popliteal fossa. And for this artery, you have to press a little more deeply. Two plus in the patient's right leg. Two plus in the patient's left leg. Now I'm going to palpate for the posterior tibial artery. And so to locate that, you would want to go to the patient's medial malleosus, just behind it and below. And just feel with the pads of your fingers. Two plus on the right. 2 plus on the left. And so now I'm just going to remove the patient's socks to assess the dorsalis pedal pulse. And so to locate that area, I would just go in between the patient's great toe and the top of the patient's foot. Dorsalis pedal pulse 2 plus in the right foot. Dorsalis pedal pulse 2 plus in the left foot. And so now what I would do is I would assess the patient's legs and feet for any edema. I do not note any swelling or edema in this patient's legs and feet. However, if I wanted to assess for edema further, you can press on the patient's legs and just take 2 fingers and press in the patient's legs to note for any pitting edema. To grade pitting edema, you would use a grading scale of 4 plus for very deep pitting edema that lasts for a long time, all the way to 1 plus, which would be like a slight pitting edema that doesn't last very long. Now I'm going to assess the temperature of the patient's legs and feet. I'm going to do that by using the backs of my hands. You want to use the backs of your hands because they have more thermoreceptors than the fronts of your fingers on your finger pads. So I'm just going to take my hands and assess the patient's skin for temperature. I did note that this patient's skin is warm and dry. That concludes my cardiovascular and peripheral vascular assessment. I'm now going to perform my final room scan.